first, I want to transition us into the next presenter, and then we're going to have a spectacular close out for us today. He is the chairman of the National Council on Disability. He is a shareholder with the law firm of Robbins, Salomon and Platt, LTD in Chicago, Illinois, where he focuses his practice on disability rights and healthcare law. He is also a board member of the ADA 25 Advancing Leadership Institute, a Chicago-based nonprofit whose mission is to increase civic engagement by developing and building diverse network of leaders with disabilities. He has written numerous articles for national and state professional healthcare and legal organizations on the application of the Americans with Disabilities Act of 1970 and the Rehabilitation Act of 1973 and Section 1557 of the Affordable Care Act to healthcare providers. Please direct your attention to the screen for the amazing Andrés J. Gallegos.
I am Andrés Gallegos. I am the chairman of the National Council on Disability, and I am a member of the disability community class of 1996. I am a Hispanic male with fair complexion, exceedingly gray hair, black squared frame glasses, and I have on a blue striped suit jacket with a white shirt and a gold tie. And I'm speaking to you from my home office in Chicago, Illinois. We are a connected global community. By definition, that means people and nations around the world economically, socially, and politically interdependent. An estimated 7.9 billion human beings, all of different shades of color, different languages, religions, gender, economic, and social stature. 1 billion of us are people with disabilities. We each share those differences, but we also have a lot in common. Namely, throughout the world, people who are blind or with low vision nevertheless have a vision of what they want for themselves and their families. People who are deaf or hard of hearing nevertheless want to be heard. People with communications disabilities nevertheless have a voice, and people who are mobility impaired nevertheless want to move forward. How people with disabilities around the world fare is dependent upon cultural, societal, and political views of disability, and by the disability-specific policies enacted by their country's leaders. Uniformly throughout the world, it is societal, environmental, and political barriers that create disability, that inhibit our ability to live fully independent, self-directed lives, that impede our ability to be integrated into every aspect of our respective societies. Throughout the world, people with disabilities remain one of the most vulnerable and marginalized communities. The global COVID-19 crisis has deepened pre-existing inequalities, exposing the extent of exclusion. But it also highlighted that work on disability rights, equity, and inclusion are imperative. People with disabilities, representing 15% of the world's total population, are among the hardest hit in this crisis in terms of fatalities. It's not that COVID-19 attacks disability per se, but the fact is that we have a greater likelihood of experiencing comorbidities. Comorbidities such as heart disease, lung disease, obesity, and diabetes, among other conditions and diseases. Comorbidities that make us less resilient to fight against the infection once contracted. That makes negative outcomes more likely. People with disabilities are more likely to live in poverty, and that's true here in the United States, where nearly 26% of people with disabilities are living in poverty as compared to just over 11% of those without disabilities. And according to the World Bank estimation, 20% of the world's poorest people have some kind of disability. Living in poverty means that you lack access to good nutrition, sanitation, healthcare, as well as safe living and working conditions. People with disabilities are also more likely to live in congregate settings without any ability to safely social distance. And in those congregate settings, we are reliant upon personal care attendants, creating a greater propensity for contracting the disease. The pandemic has unmasked significant disability bias, particularly in healthcare settings where healthcare providers outright refused to provide care and treatment for those of us infected with the COVID-19 virus. That occurred even when healthcare rationing was not invoked. In many instances, the rationale was subjective normative judgments about our quality of life, ableist perceptions that our lives are not worth living. Within the disability community, people with intellectual and developmental disabilities and those who are medically fragile and technologically dependent faced a uniquely high and explicit risk of being triaged out of COVID-19 treatment when hospital bed supplies and personnel were scarce. We were denied use of our personal ventilator devices after admission to the hospital. At times, we were denied the assistance of critical support persons during hospital stays. Informal and formal crisis standards of care, documents that guide the provision of scarce healthcare equipment, medication, and supplies in surge situations, targeted people with disabilities for denial of care. Here in the United States, disability-based discrimination was so blatant and prevalent throughout our healthcare system that the federal government had to issue emergency bulletins to healthcare systems across the country, reminding healthcare systems that during the pandemic, the federal non-discrimination mandates apply and will be enforced. Think about that for a moment. In the midst of a global healthcare crisis in the United States, the federal government had to admonish healthcare systems not to discriminate against people with disabilities. What does that say about us? It's been said that a nation reveals its character by the values it upholds, and that a crisis reveals character. We have a character flaw. That systemic discrimination occurred even as over 3 decades ago, the United States enshrined into law the principles of equal opportunity and full inclusion for people with disabilities through the Americans with Disabilities Act, landmark federal legislation which upholds the principle that we are entitled to a set of fundamental freedoms and protections. This progress has made America a leader in advancing the rights of people with disabilities around the globe. With leadership comes responsibility. Responsibility to do better, to be better. I am proud to be the chairman of the National Council on Disability, an independent federal agency that has as its mission to advise the president, his administration, Congress, and federal agencies on all policy matters affecting people with disabilities in this country and in our territories. We are 9 presidentially and congressionally appointed council members, supported by an extremely talented and dedicated staff of 11. The National Council on Disability has a proud history of advancing the enactment of the Americans with Disabilities Act. The National Council on Disability authored the first draft of that legislation. And since its passage, the Council has served as a federal voice for people with disabilities in both our mandated advisory role and that of promoting policy that enhances the lives of people with disabilities. To that end, the National Council on Disability proudly supported the efforts of the United States as it provided fundamental and valued technical assistance to the United Nations Ad Hoc Committee in the development of the Convention on the Rights of People with Disabilities, a convention that is modeled after the principles embodied in the Americans with Disabilities Act. After the adoption of the convention by the United Nations in 2006, the National Council on Disability advised the president to sign the convention. Doing so was critically important to signal the United States' clear support for the principles of this landmark treaty, as well as to continue our country's tradition as a world leader for people with disabilities. While the United States became a signatory to the convention in 2009, we have yet to ratify it. Over the years, the National Council on Disability has encouraged ratification of the convention. It is the first international treaty to address disability rights, a treaty that promotes the full inclusion for people with disabilities on an international level. Without ratifying the convention, as a country, we weaken the strength of our voice speaking out on these issues internationally. Nevertheless, the National Council on Disability has continued to advise our federal leaders on the importance of promoting accessibility and inclusion of people with disabilities in foreign assistance programs that are funded by the United States. And we will continue to advise our federal leaders to ratify the convention. The need to protect disability rights does not end at our borders. It's been said that a commemoration is a call to remember. Thus, on December 3rd, the International Day of Persons with Disabilities, let us remember that disability knows no boundaries. Let us remember that disability is not a characteristic that stands alone, but is one that intersects with all other aspects of a person's identity, such as age, race, ethnicity, income level, sexual orientation, gender identity, and religion. Let us remember that 15% of the world's population are people with disabilities, and that disability can occur to any person at any time. I know this personally. 25 years ago, this past November, I joined the disability community in a fraction of a second as a result of a horrific automobile accident where I sustained a spinal cord injury resulting in quadriplegia. It took me approximately 10 years to embrace fully my disability. As I reflect on why that was, I can tell you that I had internalized all of the negative societal disability stereotypes, negative attitudes about disability, stigma, low expectations, and even fear. Disability was something to be avoided. Let us remember that in all regions of the world, persons with disabilities face attitudinal barriers, prejudice, and low expectations. Prejudice and attitudinal barriers that often results in abuse, exploitation, and violence. Those negative attitudes and prejudice impact virtually every aspect of the lives of people with disabilities. It impacts our ability to choose where to live and with whom, to choose whom to marry and start a family, to access education, and to participate in meaningful employment. Let us remember that disability is a natural part of the human condition. In closing, as much as a commemoration is a call to remember, it's also an opportunity to recommit ourselves as we move forward. Thus, on the International Day of Persons with Disabilities, let us recommit to shaping a future in which all members of this beautiful community can have and enjoy full rights, free from discrimination, to live self-directed, independent lives, to achieve our full potential. Achieving our full potential is only possible if we're able to attain and maintain good health. For decades, millions of people with significant disabilities and those who love them have fought individual battles with physicians, hospitals, healthcare systems, and health insurers to receive basic medical services, thorough examinations, life-sustaining treatment, and medical equipment and supplies necessary to live independently. While lives around the world are getting longer, the stark reality is that if you are a person with a physical, intellectual, or developmental disability, your life expectancy is less than that of someone without disabilities. And that is true here in America. For decades, the National Council on Disability has espoused that attaining and maintaining good health is important for everyone, but it is imperative for persons with disabilities. It is truly the predicate to our ability to live, our ability to learn, and our ability to earn. So that people with disabilities achieve their full potential and live out their dreams, let us commit to achieve health equity for all people with disabilities, which here in the United States requires at a minimum a federal mandate that requires the adoption and implementation of disability cultural competence curricula for medical and other healthcare professional schools so that students learn how to care for people with disabilities. Requirements for healthcare systems, hospitals, medical and dental clinics to acquire accessible medical diagnostic equipment. Requirements to capture disability data in all public health surveillance systems to assess the impact of public health threats and events on populations with disabilities, so that the effectiveness of planning and response can be assessed and improved upon. And the designation of all people with disabilities as a special medically underserved population. With that designation, then among other things, it provides access to meaningful federal research funding to address the health disparities between people with disabilities and those without. It also provides loan forgiveness for physicians and other healthcare professionals to incentivize dedicating their professional lives to caring for people with disabilities. Our progress at home reflects our full commitment to the rights of people with disabilities around the world. To achieve health equity, to address the barriers that inhibit our inclusion in every aspect of our respective societies, we are only limited by the will and conviction of people. If we find that collective will and conviction, if we commit ourselves to addressing these issues in a post-COVID-19 world, people with disabilities have an opportunity to thrive, to achieve our vision, to be heard, to have a voice, and to move forward.
Great words from Andrés Gallegos, National Council on Disability. One of the things I took away in writing down in the notes is we see who we are in times of stress and duress. And we have a gentleman that's about to come speak to us right now who I had a chance to have a conversation with yesterday. I was so impressed with kind of his vision and how he looks out at things from a different lens. And